Yes, Bristol Hospital is hosting a free monthly geriatric medicine and dementia educational series, and it's going to be led by my guest here, Dr. Margarita Reyes, joining us once again this morning. Good to have you back. A pleasure.
You.
All right, yeah, I want to talk to you about medications that are used for people who have dementia. I don't know much about it. I was telling you that before. What are some of the most common medications that people use to treat dementia?
So before we talk about medications, I think it's important to stress that eating healthy and staying active physically, mentally, and socially is equally, if not more important than medications for the treatment of dementia.
Okay.
Currently, there are two classes of medications for dementia. First, there are the cholinesterase inhibitors given for mild to severe dementia. Then there is memantine given alone or in combination with the cholinesterase inhibitors for moderate to severe dementia.
Do they more or less work on the same mechanism, or are they completely separate?
Completely separate.
Okay, well, what are some of the benefits? What do they do?
Current available treatments are not curative, but data shows that these medications have modest benefits for treating the symptoms of dementia. In other words, it is patients who are on these medications that have better outcomes in terms of cognitive or brain function decline, second, functional decline or day-to-day independence, and third, control of mood and behavioral symptoms.
Do they have any drawbacks?
Yes, of course. Any medication can have side effects, stomach upset, diarrhea.
All right. So it sounds like you want to take these in conjunction probably with a more, I always say holistic. I don't mean, just a more whole way of treating it. What you said earlier, I want to get back to that, because I've always heard that old saying that the brain's like a muscle. You've got to exercise it to keep it strong, and what you're saying seems to support that.
True. If you don't use it, you lose it. Chew with the brain.
What medications maybe should people who have dementia avoid?
There are medications that work opposite in terms of mode of action, opposite of the cholinesterase inhibitors, which is one of the medications that are given for dementia. These are called anticholinergic medications.
Okay.
An example of this is a medication we commonly find over the counter, sleep aids or PM medications that contain diphenhydramine.
Okay, yeah, I've heard of diphenhydramine.
Yeah, so symptoms of dementia can often improve once we start to peel off these medications one by one. It's called deprescribing. Okay,
and there's a lot to get into. Of course, we don't have the time for it. That's why Bristol Hospital has these periodic, I guess we can call them sort of discussions. And the next one's happening Wednesday there. That's July 11th, noon to 1 at Bristol Hospital. What can people expect when they come to one of these?
So they will learn about the current available treatments. I will talk about future treatments, and I will also put a lot of emphasis on medications that should not be given for patients with dementia.
Yeah, especially because it sounds like with a lot of these, there's no reason you would make a connection like between a sleep aid and dementia problems. So it's definitely something you're going to want to know, especially if you're trying to take care of a loved one entering the golden years, as we said. Dr. Reyes, thank you so much for the time. Good to have you back
Always a
again.
pleasure.
All right.